So I'm going to go ahead and get started. We are going over the Q4 plan changes for 2022. And I am Tanya Smith. I am one of the provider relations representatives and will be going over this information with you. Today in our agenda, we will be reviewing health plan changes, prescribing provider requirements, some content on referring and ordering provider changes, always COVID-19 billing updates, and then again, questions and open discussion. For 2022, most of our health plans did not have a lot of changes. So we're not going to go into details as for each line of business. What I would do is encourage you all to go to the links provided within this and review each weekly until all of the benefit information is updated. The biggest changes for our 2022 plan are for Samaritan Advantage health plans, and we do have Danielle Hunter. She is our Medicare Programs Implementation Program Manager, and she will be going over all of the details and the changes for this health plan upcoming year. So please welcome Danielle Hunter. I will be advancing the slides for her, so please bear with me as we deal with any technical issues that may come with that. So please welcome Danielle.
Thank you, Tanya. No, my title is a mouthful to say, isn't it?
It is a mouthful to say for sure.
All right. Well, thank you guys so much for having me. I'm really excited to share these changes with you. For 2022, we really took an opportunity to reinvest in our plans so we could lower premiums, lower copays, and add some benefits that we really think will improve our members' lives. So with that, we'll go ahead and get started. This is really just a high-level overview of the changes that I felt would be most pertinent for you all as our providers. So it doesn't list every single benefit that has changed, but it's a pretty big one. So first up are our premium changes. Our conventional plan, which is our plan that does not offer any pharmacy benefit, we've lowered that premium from $70 to $50 per month. So it was a $20 a month price drop, which is pretty big, but still not as low as we would have liked, recognizing that other plans who offer a plan that doesn't have pharmacy coverage tend to have lower premium amounts. So we are looking to continue dropping that for future plan years. But I would note that we do offer a lot richer benefits on that plan than some of the other plans that don't have pharmacy coverage. Our Premier plan, so we've lowered this premium for the third year in a row. This year it went from $35 down to $19. We were at one time considering a $0 premium plan option, but in doing an analysis ourselves and with some of our vendors that we work with, we found that the $0 premium plans don't perform as well as you would initially think. So typically they offer higher out-of-pocket maxes, higher copays. And so we found having a lower premium but richer benefits is really better. So that's what we've done for this year with our Premier plan, as you see as we progress through this. And our special needs plan, which is our dual eligible plan for members who have Medicare and Medicaid coverage, that premium amount raised from $36 to $40.50. And I would just note that premium is actually determined by CMS. We don't get to set that one, but members who are on that plan don't actually pay that amount out of pocket because they have assistance from the state. That amount is picked up by them.
Those are some substantial price cuts. This is great to see.
Yeah. So our Premier Plan Plus, I know I didn't put on here because we didn't change it. We did keep that premium amount the same, which is $129 a month. It's our richest plan, and we've found in looking at competition that we're really in a good position with that premium amount and the benefits that we offer. So we left that one the same.
That's wonderful. I do see a hand raised. I'm just trying to figure out.
Who it is.
Yeah. The lovely technology, you know, it's
It can help you.
looks like Linda B has a question from Oregon I. Go ahead, Linda. Let me see if I can unmute you. Hang on. Well, maybe not. Hang on. Every time I hover over the microphone, it goes away. Linda, can you try to unmute yourself to ask your question? And if not, can you type it in the chat? Okay, well, we're going to have to move on just so that we can be mindful of everyone's time. We will touch base with you before the end of this and see if we can't get you unmuted to ask your question, Linda. But if you want to go ahead and move on, Danielle, we'll catch questions at the end as well.
Yeah, absolutely. All right, so some key services that we've lowered copays on are primary care visits. So we actually worked with some of our providers through the Samaritan Medical Group to get feedback, on where they felt that there were barriers for members to be able to receive care. And one of them was the copay related to office visits. So on our Premier plan, we've lowered the primary care visit copay from $10 to $5. Premier Plan Plus from $5 to $0.
Wow.
And then our conventional, we kept the same at $10. Outpatient mental health and psychiatric services. So some of you may be familiar that Medicaid and commercial plans have mental health parity laws. Medicare isn't subject to those at this point, but we still felt like it was really important to align the costs for our mental health and psychiatric services with, our primary care services. So we've lowered the copays for those visits to match what a primary care visit costs. So for our Premier plan, that means the copay went from $30 to $5, Premier Plus $30 to $0. And the conventional plan, $20 to $10.
These are great cost shares. This will be very helpful for our members.
Cardiac and pulmonary rehab. So we actually made this change due to provider feedback. I say last year, but that's really this year in 2021. We had increased it from a $0 copay to a $25 copay because that aligned more with industry standard. But we received some feedback, about concerns of that being a barrier to this type of care. So for 2022, we've dropped that back down across all our plans from $25 to $0. And then for pharmacy, 90-day supply. So this would apply to our Premier Plan and our Premier Plan Plus. We're incentivizing members to get a 90-day supply of their meds on these tiers for a lower cost. So previously it was basically 3 times, the cost of a 1-month supply to get a 90-day supply, and now it will only be 2 times the cost. So for tier 1 meds, that means their copay goes from $9 to $6, tier 2 $27 to $18, and tier 3 $141 to $94. So we're hoping that will help with adherence rates and things like that. And then you can go ahead and go to the next. Okay, so some new benefits. Dental isn't necessarily new on all of our plans, but we have made it so that all of our plans, except for SNP, because they get dental through their Medicaid coverage, will have dental benefits in 2022. So our conventional plan members will have $750 per calendar year to spend in combined coverage for preventive and comprehensive dental services. So when we say preventive, for us, that means exams, cleanings and x-rays. Comprehensive that's things like extractions, fillings, periodontal services, that kind of thing. So it used to kind of be separated for our plans that offer dental, but now it's just one big lump sum and they can spend it, how they want to or they need to for their care. So the Premier plan will have $1,000 per calendar year in combined coverage, and our Premier Plan Plus will have $2,000 per calendar year in combined coverage. And the next one we're really excited about is the quarterly allowance for over-the-counter items. So this was something that we were offering on our special needs plan. They only had $40 a quarter though, and none of our other plans had it. So this year we're adding it across all of our plans. The conventional Premier and Premier Plus plans will all have $100 per quarter to spend on eligible over-the-counter items. That amount does not roll over from quarter to quarter. It's a use it or lose it. And then the special needs plan has $150 per quarter to spend on those.
And where do members get the over-the-counter eligible items? Is that something that you're addressing from a sales perspective? How do they know about this, and what can our providers do to assist in that education?
Yeah. So we'll actually talk about that a little bit more in some of the
Okay.
next slides. So I'm going to wait to answer that.
Thank you. You want me to move forward then?
Yes, go ahead and move forward.
Inquiring minds.
Okay, and so new benefits continued, transportation. So we are offering transportation benefit on all of our plans. The conventional Premier and Premier Plus will have 12 one-way trips, so 6 round trip really per calendar year. The special needs plan has 24, so they'll have 12 total, which is in addition to transportation that they already get through their Medicaid coverage as well. But what we're offering under the Samaritan Advantage plan is much broader. So members can use this benefit to go to any health-related location. So it's not just limited to a provider office or a pharmacy for something that is a covered benefit. They can go to the gym. They can go to a senior center to attend an event. They could go to I just lost my train of thought. But basically anywhere if it's something that can improve their health, they can use this transportation benefit to do that. Which is really exciting. There aren't a lot of plans in our service area that offer this benefit.
Sounds like that includes mental health too.
Yeah. Oh yeah. Mental. Yeah.
That's awesome.
And chiropractors, acupuncturists, all that stuff they can use this to go to.
Wonderful.
So we're really hoping that this helps bridge some of the gaps in care for our members. And then hearing aids. So this, we did offer hearing aids on a couple of our plans, but now we're offering that as a benefit on all of our plans. So the conventional and the Premier plan will have $500 a year to spend towards hearing aids, supplies or repairs. And the Premier Plan Plus will have $1,000, which increased from $500. And the Special Needs Plan will have $750. Which was also an increase from $500 in 2021. All right, you can go ahead and go to the next slide. Prior authorization changes. These are always fun. So we added some clarifying language to our exception for diabetic supplies. Just to call out, this is really more about standard diabetic supplies. So standard glucose monitors, your Lancet devices, Lancet's control solution. And this only applies to those items which you would get through the medical plan through a DME supplier, not the ones that you would get through your pharmacy benefit. And then added clarification that it's that routine eye exams do not require prior auth for out-of-network providers. And so that's really because, you know, a lot of members, they want to go somewhere like Costco or VisionWorks and some of those places that may not be contracted with insurance plans. But if you're going to just go there to get glasses and do a routine eye exam, you know, that's okay. But Medicare covered, which are the, you know, the medical vision exams for medical conditions like diabetes, macular degeneration, et cetera, those would still need prior authorization if you're going to an out-of-network provider. We added clarification under speech therapy that swallow evaluations do not require prior authorization. We did add a requirement that all miscellaneous DME codes require prior authorization. We also added prior authorization requirement for magnetic resonance angiography, or MRA. We removed the prior authorization requirement for urine drug tests. So for those of you that are familiar, that required auth after a certain number, but we've just removed that completely. And there should be more information going on some other educational materials about that one. And then we added a few drugs to our Part B drug list that require prior authorization, and I am not going to try to pronounce those.
I wondered if you were going to take a stab at those.
You know, I worked in pharmacy for a long time, but it's been a while, and nobody wants me to do that.
I was gonna say, do we have anyone in our audience that wants to take a stab at some of these? Pretty much everybody's like, no, I'm good.
All right. Okay. So this is where we'll kind of get into more detail about the OTC benefit that I mentioned. So something new that we're offering next year that we're really excited about is a benefit card. So this is a MasterCard that will become preloaded to the member with their funds to pay for their over-the-counter items, their routine vision hardware, hearing aids, hearing aid supplies and repairs, and their preventive and comprehensive dental services. So all they have to do is, you know, hand their card over to the provider at the counter, and they'll just swipe it, and it will pay for, you know, up to the amount that they're covered for that benefit. So for OTC, you know, that means they have either the $100 or $150 per quarter routine vision. Most of our plans, we give $125 a year. The hearing aid amounts that we talked about earlier, and then the annual dental amounts that we talked about earlier. So really just meant to make it a much easier experience for the member. For these services, they don't have to pay anything upfront out of pocket. They don't have to, you know, wait for the provider to bill the plan and the plan to process the claim, and then, you know, how much money do I have left? I don't know. They'll have a portal they can easily access to see that with. So we're really excited about this one. So for the OTC benefit, so as I mentioned, that quarterly amount is automatically loaded onto their card the first day of each quarter. And they can use their card to pay for eligible over-the-counter items, at any retailer or pharmacy that accepts MasterCard and has what they call full inventory information approval system. So that that just means basically their system is set up to recognize if something is eligible as an OTC expense or is not. And so some examples of retailers in our area, like Bi-Mart, Walgreens, Walmart, a lot of the big ones that members would already go at anyway, they are covered for our service area. And so the card will when they swipe it, it'll automatically pay for anything that is covered. If it's not, it'll decline the payment just for those items. And then the member can choose to either pay separately for those, or not purchase them because they weren't covered. If they forget their card, for some reason it hasn't been issued to them yet, or for some reason it's not working, they do have an option to submit a member reimbursement request for those items still. And if it's covered, we can refund them for those amounts.
It's so impressive. All that's been done to help our members. This is amazing.
Yeah, we're really excited. You can go ahead and go to the next slide. And then, so for dental, routine vision hardware, and hearing aids, same thing where that annual benefit amount is automatically loaded to their card on the date that that's issued. And then it would, again, they keep that same card as long as they're on our plan, and it would automatically reload for the next year. The card is controlled by what's called merchant category codes. So anywhere where you have like a credit card swiper, there's a merchant category code associated with your business. And so we've turned on only the ones that are, for dentists or a vision provider or hearing aid provider. So that prevents the card from being able to be used at an ineligible location for those expenses. And same thing, so they just swipe their card and it'll pay for up to that amount that is covered. So if a service is, costs more than, like glasses, realistically, you're going to pay more than $125 in a lot of places. It would just work for that $125, and then the member would need to use a separate form of payment to cover the rest. So services that are covered with this card: routine vision hardware, so lenses, frames, and contacts, hearing aids, hearing aid supplies, and hearing aid repairs, and preventive and comprehensive dental services. So your cleanings, exams, x-rays, etc. Things that are not covered are routine vision exams, Medicare covered vision exams, Medicare covered glaucoma screenings, and hardware following cataract surgery. So those would all still need to be billed to Samaritan Advantage on a claim form, and we would process those. Routine hearing exams and routine hearing exams and Medicare covered hearing exams. And then Medicare covered dental services, which is really a very specific subset of dental services that aren't super common for our members. And I would note orthodontia is still not a covered benefit under dental for 2022 as well. So, and you cannot be a provider who has opted out of Medicare, which I'm assuming there's probably none on this call, but put that out there. Go ahead and go to the next slide. And then the new transportation benefit. So we talked about the allowance again already. I won't go through that again, but and some examples of the health-related locations. So this will be administered by Rideline, who is currently our vendor that does transportation for our Medicaid line of business as well. And it'll be a very similar process for the members. They call Rideline, ideally as soon as they know they have an appointment or somewhere that they need to go, so they can get that set up in advance. They'll ask for some details, about the appointment or the need for transportation, and get that scheduled. So we are covering sedans for ambulatory members and vans for wheelchair-bound members. This benefit doesn't support gurney transport or people who need some sort of life support with their transport. But there are no distance limitations. So yeah, you have a member in the Valley, they need to go to Portland or Eugene or Bend or, somewhere like that they can take them there.
Wonderful. Next slide.
Yep. Yeah.
Looks like that's it.
Fine.
Okay. So before we move on, I'm going to see if anyone has any questions. If you do, raise your hand and I will see if I can unmute you. I know Linda had a question at some point. And I do see a question in here regarding prior authorizations for the miscellaneous DME codes. The question is, are all Samaritan Health plans going to require PA for all miscellaneous DME codes as of 2022 or just Samaritan Advantage? And I don't know if we know that answer, but Dana, I will definitely look into that and then get back to you, because that is, we only have the guru for Advantage right now. So. Okay, Tammy's question is, are they still only allowing 1 per 7 days? And that's in relation to a telehealth or teletherapy. And I honestly do not know that offhand. We do have one of our other provider relations, Laurel, on the line. Laurel, are you familiar with that question at all? If not, no worries. We will look into this and get back to you for that as well.
Tammy, I have not heard of that limitation. I know that for IHN, a lot of the telehealth services were not as strict, and they're still following that policy. So was your question in regards to IHN? Okay.
Yes.
Well, I will double check on that, but I don't think that there's a limitation, but don't quote me on that. I will get back to you.
Yeah, definitely want to make sure we get that answered for you, Tammy. So, and for anyone else that might have that question as well. And then Heather had a question. When COVID hit, many mental health therapists, if not most, moved online. Many have given up their physical offices because it doesn't make sense to pay for space you don't use. Are there any plans to change requirements for telehealth providers or change billing requirements? I'd also like to hear how IHN is seeing this trend in mental health, if there's time. So this is a great topic, and certainly one we want to address in more depth as well. So at this time, I am not familiar with any changes. We are following Medicare and Medicaid guidelines as it relates to telehealth requirements. So as they change, we will likely change as well. Heather, if you want to drop your email in the chat, I can always email you and update you specifically if we hear of any changes related to the space requirement and moving solely to telehealth. But right now we are just kind of adapting our business practices based on the needs of COVID and Medicare and Medicaid guidelines. So hopefully that answers your question. And thank you, Heather, for that. I will get back to you, obviously, with any requirements that we have. So any other questions for Danielle specifically related to the Samaritan Advantage? This is great exchange, and I love this. I love the questions, and I love the interaction that we're getting. These are meant to be collaborative and meant to address all of your questions, because likely someone else will have the question as well. It's almost inevitable that everyone's like, oh, it's a good question. I don't know the answer to that. And if you always know the answer or already do, please feel free to share. This is collaborative, and you guys can all help each other. I am Tanya Smith. I am one of the provider relations representatives. I typically do the webinars and, of course, welcome in guests and guest speakers to share their expertise. In the meantime, I will be addressing changes for Medicare and Medicaid. We, as a health plan, do want to share our information with you as providers to make sure that you are in the know and able to assist our members the most efficient way based on the changes that come to us. Many of our changes, again, are based on Medicare and Medicaid guidelines, and as we move to align with those, we do have some impending changes and maybe some immediate changes that might affect your office. So the first one that I'm going to go over are changes in relation to our prescription coverage. The Medicaid and Medicare integrity regulation changes do require that providers that write prescriptions have and are registered with Medicaid. And so as you are questioning whether or not your providers that write prescriptions are or not, we do have the ability for you to check that. So effective January 31st, 2022, IHN is going to stop covering prescriptions written by non-Medicaid enrolled providers. So we want to make sure that you have time to get your providers registered if you're not already. And you can verify that information by going to the MMIS state portal system. This rule does apply to all pharmacists and residents. So if you have any questions, again, go to the MMIS portal, and you're going to scroll down to the Oregon Medicaid NPI verification. You can enter in your provider's NPI, and then down at the bottom, there's a search option. If you click search, it will pop up and say you are a valid NPI, or you are a valid registered provider, or you're not. For those of you that are not registered, there are forms that you can complete. They are located on the OHA website. And once you complete the form, you can send those back to us by fax or directly to us via email. And we will assist in getting those processed for you. This is separate from the Oregon Medicaid form, so just make sure that you are selecting the OHP 3113 form, and that is specific to non-billing providers, so rendering or ordering, prescribing, referring providers, or if you just want provider web portal access. If you would like to learn more about these requirements and where they're coming from, you can review the references. There's lots of CFRs pertaining to this. There's an OAR, and then there's a member protection provision. You can also contact our customer service department. They are available Monday through Friday, 8 a.m. to 8 p.m. By phone. So please feel free to reach out if you have additional questions. And again, you can email us directly at shpprovider@samhealth.org. We had mentioned earlier that there are some changes to COVID vaccines. There have been some new guidance and approvals by the CDC for some of the actual biotech, Moderna, Janssen. They have all been approved to administer those or be CDC approved for boosters. They have also expanded the approval for patients ages 5 to 11 for the Pfizer biotech. And then beginning January 1st, 2022, vaccines and its administrations are now going to be billed to the Medicare Advantage organizations. So historically, you would bill this Medicare directly for those. As of 1/1/2022, you will want to administer those claims to us for processing. And you can learn more about the claims submissions at our website at the providers.samhealthplans.org, and then go to our submit claims, and you can find our EDI vendor information there. Excuse me. Another change that is happening for us is that we are going to align the requirement for DME, radiology, and labs to also be included, not only just for IHN and Advantage, but as of 1/1/2022, the requirement for documentation will also include for Samaritan Choice and commercial lines of business. So our federal regulations, which are located at 455.410 at the CFR, requires that all ordering and referring physicians or professionals providing services under the state plan be enrolled as participating providers. So those referring and ordering providers for DME, radiology, and labs are required to submit claims with a valid NPI a valid license. And then for IHN, they will also need a Medicaid registration number. So if you have any questions on that, again, contact our customer service department. They can assist you. And we also get a lot of questions related to out-of-state Medicaid numbers. Just want to let you know that those will not work. Each state must be registered for separately in order for reimbursement to be had. So at this point, we will kind of go ahead and open it up to questions and discussions. It looks like we do have a few comments and some discussion that was wanted. Looks like Heather has posted a question indicating, I have not had a problem billing for 2 sessions in 7 days for mental health clients. There are times when clients are experiencing crisis and require the level of support. It can, in fact, keep clients out of the ER or out of higher levels of care. My understanding is that IOP level of care is 3 or more contacts per week. So I think you're probably right in that since we do not have, since we follow Medicare and Medicaid guidelines, that we would likely follow that as well. Laurel did provide some guidance in the chat as well, and providers may bill for telehealth and online services once per 7 days. Coverage does not include chart reviews. So we can, look into that just to make sure that we are aligning our claims payments with the policies that are placed. So we will do some additional research on that. But providers can bill for services for new and established patients, even if the codes specify existing patients. So hopefully that will provide some help and guidance for you. Since we could not get the poll to work, which I'm not quite sure what happened there, are there any questions or trainings that you guys would like to share with me so we can plan for our 2022 plan year? I know we have lots of things that we would like to share, but we want to be mindful of the, your guys' time and make sure that it is meaningful content and helpful information. So, possible topics might be related to improving quality health. Do you need help with billing? Perhaps you'd like to improve your CAP scores, learn more about CCO or STAR measures. And then, of course, anything else that you might be needing help with. It sounds like we have some questions on telehealth. That might be a good benefit to kind of review in further detail. And then, of course, if there's anything else. At this time, go ahead and please join us on camera if you'd like. We can put names with faces and just have a great exchange as to how things are going. We have about 20 minutes left, so grab a cup of coffee and join me.
Hi, can you hear me?
I can.
Okay. So with that, snippet that I posted is directly from the Oregon Health Authority. So that is their rule. Whether our system is set up to follow that rule is the question, and that's what I will for.
Okay, thanks, Laura. I appreciate you following up on that. And just to remind all of you, we do follow Medicare and Medicaid guidelines. However, we as a health plan do have some abilities to provide additional services beyond what they provide. So that might be what we're seeing as well. So as Laurel kind of reviews that to make sure that our system, to see what our system's doing and what we've decided as a health plan, that might be helpful for all of us. Anyone else have questions, comments? John, how are things going for you in the mental health world? I'm sure you're very busy.
How's that? Can you hear me?
Perfect. Yes, wonderful.
Well, I'm glad you asked me. I'm just trying to get information, and I have one client that has been solely telehealth in Sweet Home, and he has some pretty severe mental health issues, and also he's has a parole officer, and so he doesn't trust, he trusts me because we worked together for a long time. But I've had to do a lot of case management work, maybe more than a couple of times a week, particularly around suicidal interventions, talking to the police, stuff like that. But it's all on, I never see him, and I've requested additional services from Lynn County Mental Health, but they are very thinly available. And, it looks to me like what I'm doing is probably the best this guy's going to have at the present time. So I have a dilemma about that, wondering who to consult with. That's one concern I have.
That's a valid concern, and definitely I'm sure you're not alone in that dilemma. We do have care coordination that I would highly encourage you to reach out to for additional support. They can perhaps help you, and I can get you that information if you want to drop your
Thank you.
If you want to drop your email in the chat, we can certainly reach out to you with that care coordination information.
Okay.
That is definitely one. And then are there other mental health providers online? Is there anyone here that would like to share with John how you guys are managing situations like that, or what you've done in the past? John, this might be also something we can address from an additional training perspective for our mental health, behavioral health providers, just to kind of give them some resources and tools. And I can work with our internal departments, to get something on the docket for 2022 that might help you guys.
That'd be terrific. Yeah. Is Laurel the person I should contact for information or consult?
Laurel is your provider relations representative, and anyone in mental health, behavioral health, she is your guru for research and contact.
Okay.
And she will definitely be able to assist you. And then, of course, if it's an educational topic in terms of like a webinar or training, I would work with Laurel to get the necessary information and get an actual training going so that we can help other providers who might need assistance.
I get Laurel's phone number.
She actually dropped some care coordination articles into the website to help you. And then at the end of the slide, when I go to the next slide, there will be her direct email information, as well as our SHP provider contact. So
Great.
Just to let all of you know, this is recorded and will be placed on our website, so you can review the links and the slides at a later time as well. We offer this training 2 days, today and tomorrow, so we will kind of review which one is best quality, less complications with technical issues, and we'll of course post that one.
I have one thing to say too. IHN has been very, very good at reimbursing me for my claims. They've done a great job.
Wonderful. No issues with reimbursement is always what we like to hear.
Yeah.
We do want to advocate for you and make sure that you guys have it as easy as possible. It is very challenging, as we know, for all of you to provide services and maintain the quality and jump through all of the requirements. So we do want to assist you however we can, and we do appreciate all that you guys do for our members. Any other questions, comments, suggestions? One of the topics that we do get quite often, or questions or concerns that we get a lot of, is related to our grievances. Grievance is a topic we get a lot because we get so many. So members will express a dissatisfaction to us. Could be related to benefits, could be related to how they are treated, quality of care. They feel that they weren't respected or their enrollees' rights were neglected. So as a health plan, we want to remind you that as a delegated entity and as a contracted provider, that we make sure you know that we are reviewing those. There's nothing punitive about it. We use these as opportunities for providing you education and resources and tools to address the grievances and complaints that we get. We do utilize the OHA guidelines that are specified in the CFRs 438.416. So we are addressing those in line with everyone else, and we want to make sure that you know not to encourage members to withdraw their complaint after it's already filed. We want to ensure that you're not discouraging our members from using the grievance and complaint process. Also want to make sure that you are not retaliating against our members if they do submit a grievance or complaint. Again, it's not punitive at all and is merely just meant for education and opportunities for all of us to improve in how we do things. If you're ever looking for detailed information, our provider manual has an amazing dive into each line of business, what the time frames are, and you can find that in section 6.2 of the provider manual. So I would encourage all of you to go out to there. Laurel has worked so hard on making sure that everything in there is up to date. It's much more in depth, and if you find that you're missing content, please let us know so we can get that information out. Because again, as if one of you has a question, it's very likely that other people do as well. So that provider manual is an extension of your agreement, so we want to make sure that it's all-encompassing and provides any questions that you might have. Just a few minutes left. I want to make sure we address any questions or comments. Just to kind of summarize, Laurel will be reaching out to Tammy as well as John regarding some mental health and telehealth answers. So thank you very much for researching that, Laurel. And then as I stated before, we are available to help you. We have our customer service department that's available Monday through Friday, 8 to 8. And then if it's a specific provider relation question, you can email us directly at shpprovider@samhealth.org. That is our group email, and the appropriate representative will reach out to you. If you already know who your representative is, like in your case, John, Laurel is our SME, our subject matter expert on behavioral health and mental health, alcohol and drug. You can reach out to her directly. And then we also have Jenny and then myself. So as we work together, you know, we definitely want to provide you with the information that you need. Looks like Laurel also added a link to our provider manual. So for all of you that are in here, please go out to that provider manual, review it, read it, know it, bookmark it, and then email us if you have any questions or comments. Looks like we have a comment coming in from Tammy. I truly want you all to know how much I appreciate this collaboration. This really is an opportunity for us to gather, and I love the collaboration and the community connection that we all have, since we are all in, you know, Linbit to Lincoln and work for the same common good. It's really great to meet and have these opportunities. So thank you all very much, and happy holidays to you as well. All right, thanks everybody. Have a wonderful day.
Thank you.